I believe most of baby care and child care and just even maybe teenage care, I don't know about that, is common sense. You know, if the baby looks sick and is acting sick, then they're probably sick. But if they're happy and they're cooing and they spit up a little and they're cooing and they're playing, they're probably not sick. So, but you need to go with your gut. So no matter what I say or anyone else says, if you're worried about your baby, you need to bring him into a physician. You don't need to worry about, oh, I'm bothering the physician. I've been in here every week since the baby's born. Well, yeah, you have, but you must have needed to come in every week because this is your first baby and you don't know anything about it and you're worried. So that's what we're here for. It is important that your baby do see a physician. I prefer them to see a pediatrician, of course, because we specialize in infants. But as long as it's a good medical doctor, they do need to see them at regular times for their, not only just for immunizations, but to get the developmental milestones checked and to get their height and weight and their growth checked. And then, of course, answer any questions that you have. So it's not just we want you to come in because we want you to come in because we want to get money for it. It's because it's important that we make sure the baby's doing well. If there is anything going on, we want to catch it early because pretty much most of it we can fix. What they most need is probably a routine. Babies do best if they have a routine, and probably most people do, where they eat at the same time, they sleep at the same time. But you have to remember that a 2-day-old baby doesn't have a routine. I mean, they're just born, they've never been out, they've never, breathed, they haven't even used the bathroom. So all of this is new to them. But once about 2 to 4 weeks go by, they'll have a routine. And it may not be your routine, it'll probably be a new routine that you develop together. You want to have the baby stuff already there. You don't want to be, oh my God, the baby's here and we don't have anything, if you can avoid it. And a comfortable chair for you, or maybe 2 for you or daddy to be in there. And if you're breastfeeding, you want to have a good place to be comfortable because you're probably going to be doing it at night. If daddy wants to help out, if you are supplementing, then daddy can breastfeed maybe and let you rest. Of course, the diapers and the diaper pail and just basically washcloths to wash the baby's bottom. You don't need special wipes or special baby lotions or any of that. I mean sometimes they're nice to have, but you don't actually need them. And if the baby's dirty, you can wipe them off with the warm water and a washcloth, which is probably better the first couple of weeks because the chemicals in the wipes may irritate their bottom, and just warm water usually will do the trick. And then we also don't recommend a lot of lotions, and definitely no more talcum powder, because sometimes babies, as they get older, they would grab the talcum and they'd throw it in the air, or they breathe it in, and it can cause problems respiratory-wise. So now we don't want talcum powder. And anything you put, it should be designed for babies so that they don't get any allergic reaction or it's not too harsh for them. But less is probably more. We tell you that if you don't have to go anywhere where there's a lot of people, to avoid that for the first probably 2 to 6 weeks of life, especially in the winter and the fall when there are more viruses around. If you do go out, like you just can't stand being in the house anymore, you can, of course, if the weather's good, you can take the baby out and you might not encounter any people. So it's safe to be outside. If you're comfortable, whatever amount of clothing you're wearing, the baby should be comfortable in. But if you're going to the grocery store, or you want to go to church, or you're going to the family reunion or something like that, and you want to go, no matter really what age the baby is when they're infants, say under 6 months, you should try to avoid letting anyone who is obviously sick touch the baby, hold the baby. And if they're obviously sick, they can look from afar. If you don't know, then of course everybody should wash their hands, especially with the infants. And if you go to the store, usually you can have them in their little carrier and have maybe a little blanket over, and be wary of anyone like me that might come over there and say, oh, what a cute little baby. May I? No, get away. It's my baby. So, but you know, I mean, in general, it's not a big issue. If it's just like they don't want to go to sleep, we suggest that, again, a routine. So they know that, okay, we do this, and then we drink, and then we go to bed, and then we go to sleep, and this is the routine, and so this is, my body's used to that. Before, we recommend if your baby's crying and they're hard to get to sleep, is that you try never to hold them till they're totally asleep and then put them in their crib. Because if they wake up in the crib later, then they're not in an atmosphere that they're used to putting themselves to sleep in, and they may cry for you. So the theory is that if you put them to bed partially awake and they fall asleep on their own, they will stay asleep if they wake up later. The most important thing about babies is to know that the way they learn is by interacting with another human being. And so the best thing to do with your baby is to talk to them, to hold them, to play with them. Even if you don't think, you know, 2-week-old baby can understand the thing you say, no, they do. They're looking at you as cues of what this means, and every little thing to them is new. They've never seen it before. Everything to them is fascinating, and that's why I wish I was a baby sometime. And so they're learning all the time. And if you're sitting them in front of a video, a screen, or they're just, you know, not having any interaction, that's very bad. Now, you can do simple things. I mean, you could have your own little, go to half-price books and get books and read to the baby and show them pictures. You don't have to get the expensive Leapfrog or any of that stuff. Myself and my partners here at Austin Diagnostic Clinic, we go by the American Academy of Pediatric Policies, and they recommend holding all solids until the baby's 4 months of age, and at that time you can introduce cereals, any cereal you want. Then once they're about 6 months, we recommend that you can start giving them any food that they can swallow without choking except honey. And that always shocks people. They say, anything? Even peanut butter? Yeah, anything. Because there's no correlation between starting after 6 months. It doesn't appear that there's any risk of getting any allergic reactions because you ate the food early. Now, obviously you could be allergic to it, but if you wait a month, you're still going to be allergic. So before 6 months, there seems to, if you introduce solids before 6 months, it increases the chance that you'll have an allergy. But after 6 months, the American Academy of Pediatrics recommends any food the baby can eat without choking that's nutritious, except for honey. Just because your baby isn't doing it and your neighbor's baby is doing it and they're the same age doesn't mean there's something wrong with your baby. So most babies are turning over around 2 months of age, but some aren't. Nowadays we put them on their back, so they're less likely to turn over, because why turn over? I'm already where I want to be, so if I turn over I can't do anything. So when we had babies on their tummies, they turn over a lot quicker because there was some reason to do it. So now they don't turn over as quickly, but around 2 months or so. And then around 4 months, they'll start to have more ability to roll. And then at 6 months, usually they're attempting to sit or are sitting. But again, if your baby's not sitting till they're 7 months old, there's nothing wrong with it. We used to also talk about crawling. But again, babies don't crawl as early as they used to because we put them on their back and there's no reason to turn over and crawl. So a lot of these milestones have changed. But yes, there are milestones that we look at. Every time the baby comes in, we ask them specific questions about the development. If we see, if there's a question that there may be a developmental issue, then we may have specialists take a look at the baby. But we try, you know, there's a range of normal.